because we've talked a lot about protein through this whole weekend. And so I have a question, even though it had nothing to do with your talk. I know I'm going to love your answer, and I think a lot of people have this question for Amy. And that is, I thought if you eat too much protein, it turns into a jelly donut because of gluconeogenesis. So can we talk about that?
Yeah, so is this on?
Is it on? There we go.
Hello, hello. It doesn't sound, I don't sound very loud. Hello?
Here, use this one.
Hello.
There.
Okay. So gluconeogenesis is a thing. It's glucose neo-new-genesis, the creation of new glucose. So gluconeogenesis is when your body makes glucose out of something that wasn't glucose, like amino acids or glycerol from triglycerides, from how we store fat, from how we eat fat. So that's the glycerol backbone of a triglyceride molecule, again, the fat, doesn't contribute a whole lot to glucose generation, but it can contribute in the way that amino acids can contribute. Does this biochemical pathway exist? Yes. Is it something we need to be terrified of? No. If you did not have gluconeogenesis, you couldn't fast. So those of you that love fasting for 3 days or a week, why don't you just be grateful for gluconeogenesis? Now, I think there may be situations of like brittle diabetes or something where you maybe need to watch the protein intake, but I think, like Peter said, I think the problem, especially because a few years ago everybody was made afraid of protein, it's less so because of the carnivore movement now, but a couple of years ago, I think the risk in the keto community was not enough protein and everybody was going crazy with the fat. So yeah, does gluconeogenesis exist? Do we need to be afraid of it? I don't think so.
So I've got, I don't know, this is going to be a good one because Dr. Westman's got a question over here. Oh, we got one over there first.
Well, first, I just wanted to say I can't overstate how grateful I am for all of you and all of the speakers yesterday as well. Thank you so much for what you're doing for all of us. And secondly, I just wanted to say, and I know I'm not alone in feeling this way, I want to do so much more. You all have really fired me up, and I'm sure a lot of us up. And I know the best thing that we can do is to take care of ourselves and be our shining light for others and live by example. But what else do you want to see from us? Just normal citizens, like what can we start to do on a daily basis? One thing. Do you have any advice for us? I'd love to hear from each of you if you have thoughts to share.
Do you want to start?
Yeah. Great question, and thank you for the acknowledgement. I think it goes back, no pun intended, to our thoughts. If we could really start to master those 60,000 thoughts, then let's say you go back home, right, and you're sharing all this information with your friends, and they're like, yeah, you're crazy. The keto thing, heart attacks, you're just going to be like a good-looking corpse, right? Those are the comments people make. Well, you have two options. When you're aware of your thoughts, then you could take a moment, understand where they are in their journey, and you could respond. And when they're ready, that conversation could be great for them to enter your world. Or we could react and say, what are you talking, and get into an argument with that person. And then we have a barrier there, and we can't make a difference for that person. So I would say we could choose to react or to respond, and it's always better to respond. And as you work on yourself, change your health, and start working with those who are open to your coaching and teachings, they'll get inspired by those results, and when they're ready to have that conversation, then you're there to have that conversation with them. But it starts with your thoughts, because that would have been lost if you would have reacted to that negative comment. So that would be my advice to you.
So I think the quickest way to turn somebody off to trying low carb or keto is to be in their face preaching and proselytizing. But I do think we are so fortunate to live. So social media is a blessing and a curse, right? It's a blessing because guess what? It's free to start a blog. It's free to get on Twitter. Facebook is free. It's free to start a YouTube account. If you have had a beneficial experience from keto, put it out there for free, because I can tell you, we have people in this room who have influenced thousands of people through their medical practices or their published research, but how many frankly, probably more thousands of people learned about it from some random blog post they found or a YouTube video that popped up one day. So don't hide it. If you have a message to share, share it. And we're just fortunate that it's so easy, not only to share it for free, but for free to reach thousands, if not millions of people.
I agree about the internet. The joke is they used to say if you give a million monkeys typewriters, they'd reproduce Shakespeare, and now thanks to the internet, we know that's not true. So the mixed blessing thing, and filters are important, but you know, it's got to. If you're looking to extend this information to others, then you know, grow where you're planted. Where you know your relationships are, where you already have a relationship with people, and let it grow from there. If you're in a profession where you're somewhat related to any of this, then carefully look for ways that you can engage there. And I did say carefully because I tell the young pre-tenure faculty members that I interact with, just you need to know this personally. And after you get tenure, then you can start, you know, doing the advocacy. So, you know, be discerning. But the first thing is to take care of yourself. You know, we are of such infinite worth that I don't think we properly appreciate that, each individually. And so we allow these negative messages to come in. And, you know, it takes two people to play catch. So, you know, don't catch the ball, don't throw it back to them. They'll get tired. You know, how many people have played fetch with a dog that doesn't fetch?
I'm still, to answer your question, I'm so humbled that I'm up here with these folks because I was down there with you like 10 years ago. And so I think the question is not what we can tell you to do, although I agree with what my colleagues here said. It's you have to ask yourself what you can do. And that's what I did. I just said, okay, I got this wrong. I made a huge mistake teaching the wrong stuff to students for 30 years. I have to pay the price for that. I have to atone for that. And so thanks to Dr. Westman and Volek and Finney and others, I just dedicated my life to that. So that's why I wrote the book. That's why I came here. And things are changing. Like a few years ago, I'd go into a restaurant and go, I'm kind of keto. They go, you kind of what? Now I say I'm kind of keto. They go, oh, okay, right. So, and then they give you gluten-free. Okay, we got a little bit of work to do. But I think, yeah, just ask yourself. I think there's lots that each of us can do. So here's the thing. Nobody ever wins an argument in the history of mankind by telling the other side they're stupid, right? What they are, perhaps, is ignorant. And I don't mean that in a bad way. They're either ignoring the evidence or they're naive. They don't know the evidence. So feel free to correct people in a kind way, in a helpful way, and tell them, listen, I'm just concerned about your health. We know, I can tell you, the best robust science will tell you that for 7 out of 8 people, a ketogenic diet is probably going to be their best non-drug-based route to optimal health. I can tell you that. And I don't tell anything that's not supported by science. So spread the word. Yeah, you're not. I deputized you. You get out there and do your thing. But no, the tide is changing. You can see keto restaurants in town. They have keto things on menu. Remember, I think during Atkins, Dr. Westman, did McDonald's not have like an Atkins burger for a little while? I think they did. But that's when we can see fast food chains starting to have keto options. I think maybe even Taco Bell has that now. But then, you know, and so my thing, just to finish up there, I'm tired of trying to convince government policymakers that we got to change things. They got blinkers on. They're not listening. They're not listening. They don't want to hear that message. So what I think we need to do, continue doing, and thank you, Chris and Miriam, for providing this opportunity to talk directly to the public. And then they can go and talk to their general practice physicians and tell them, no, I don't care what you say about LDL. Everything else is good, so I don't want to go on a statin. And you need Dr. whatever, he or she, to better inform yourself. And, you know, we all have books that will help with that. And again, Dr. Westman was sort of a pioneer there. And by the way, of my 50, 60,000 thoughts a day, 50,000 of them are about the Tennessee Titans. So.
Eric,
Packers fan over there.
Eric Westman, Durham, North Carolina. Great talks, everybody. But David, I need to, because you flatter, I need to push back and criticize. I mean,
Please do.
that's what academics do.
I
That was supposed to be kind of funny, but so I'm looking at the FDG glucose. So you radio label the glucose molecule, you give it to someone with cancer. The cancer cells take up the glucose much more avidly than the normal cells. And so what we saw is the tumors lit up. That's the FDG glucose. And then on a couple of those patients you showed, it looked like the tumor was gone. However, or is it just that they didn't take up glucose anymore? So I could imagine a reviewer looking at this data as saying, it's just an artifact that tumors aren't taking glucose up anymore. Do you have CT or objective tumor volume to show that the tumor itself actually got smaller and it wasn't just the glucose taking up less? Does that make sense?
Yeah, no, that's a great question. I'm glad you asked it. And the answer is yes, we do. We do CT and PET scan as well.
Okay, thank you.
So it's PET CT. So we do have that tumor. It's unanalyzed data at the moment. But thank you. It's a little more detailed question than I was kind of expecting. But one of the things, thank you for that, is that did you notice the heart disappearing? Wasn't that cool? And so I said to Dr. Volek, I'm going to call him Jeff because we're friends, but I said to Jeff, that's cool. And he said, oh yeah, I know, we're all over this. Like the ability remember the heart, you live as long as your heart, right? You basically live as long as your coronary arteries will let you. And so if we can see the heart shifting to burning ketones preferentially over glucose, that diesel engine liking the best, cleanest burning, high octane fuel you can put in your body, is that going to help prevent heart disease? I'm going to say PDS, pretty darn sure. Thank you.
You got one?
I do, and then we'll yield to John
I got
Schneider
tough
from the
side
Dukes
room
of Hazzard
here.
over
Look
there.
at this line over here.
Dukes of Hazzard. Dennis Williamson, type 2 diabetic, approaching 10 years of ketosis. Okay, so maybe I'm a tenured patient, deputized. Thank you, Dr. Harper. Even my doctors have gotten to where they say, well, yeah, you are the captain of your own ship, and they ask me questions. Anyway, I'm really thankful for all your talks today, especially everything I've heard since this morning. Ben, we've been talking about mitochondria. We've been talking a little bit about them and a little bit about our gut health and bacteria and all the helpful bacteria that are inside us. Can you give everybody a little brush up on the size of the mitochondria as organelles in the cell, because they're awfully small?
The average cell, great question, Dennis, and thank you for sharing that first and foremost. The average cell has a few hundred to 1,000 of mitochondria in a single cell. And as I mentioned earlier, the cells that are really metabolically active, mostly needed for survival, brain, heart, ovaries, have the most mitochondria, from 50,000, 100,000 to over 2 million, certain parts of the brain. They're very small. They're little organelles. Some of the most surprising research that I came across when it came to the mitochondria is that there's only 2 antioxidants that actually could penetrate the mitochondrial membrane: glutathione and melatonin. And we think of melatonin as typically like a sleep agent, which it could help with sleep, but it's much more than that. I've seen research that shows that melatonin is actually the most potent mitochondrial antioxidant that you could ever use. And of course, we produce melatonin, but something else that I discovered, it's not just the pineal gland that produces melatonin. Every cell that has mitochondria actually produces its own melatonin, which is super interesting. So this goes back to, and I know this is a long-winded answer, but it's something that's exciting in my mind right now. This goes back to eating before bed, right? When you eat before bed, whether it's carnivore or not, there's going to be a glucose response. There's going to be a process for digestion, blood flow to the gut. But also, if glucose is elevated, it also shuts down the receptors in the pancreas that produces insulin, which leads to higher glucose overnight, which is problematic. So to wrap up my answer here, I think we need to get our circadian rhythms in order. We need to understand there's much more to melatonin than just being a sleep agent, and just be amazed at how incredible the human body is, and it's just beyond what I could ever even imagine. And I hope that kind of answered your question, Dennis. Yeah.
I've got to start sleeping at night.
Hi, I'm Ken Berry from Holiday, Tennessee. I think one of the most important messages we've heard this weekend, Easter weekend, is Dr. Ballerstadt's message. I remember a few years back I went to KetoCon and I was looking at the speakers and I'm like, a forage agronomist, what the hell is he doing here? Now I know what he's doing here, okay? Even though you're not that kind of doctor, can you please give us just a few pointers? How can we go back to our community and start to not only feed ourselves the nutrient-dense, highly bioavailable, ancestrally appropriate food that is ruminant meat? How can we convince our friends and family that there are billionaires and multi-billion-dollar corporations who are very intent on us thinking that a plant-based diet is the proper human diet? What would you recommend we go back home and not only eat your meat, but how can we convince our relatives and our friends, you know, plant-based is not the answer?
Thank you very much. Let me suggest, anybody who's ever split wood, you start with the end of the log and there's no cracks in it, but you put the wedge in and then it starts to open up. I think metabolic health is the wedge issue. And I think that if we had relationships where we don't start, we start with a message of, here's some information about diabetes if it's diabetes, or here's some information, and we begin down that path, and obviously I'm thinking of the kind of information we've heard here as opposed to some other sources, but then at some point along the line we could have conversations about these other issues. Some specifics, I know in some school districts it's a challenge to get real food into, lunch programs. If you have food pantries in your community and you're economically positioned to where you could buy some animal-sourced food that's shelf-stable, like not be the person that takes the gallon of barbecue sauce and donates it. I mean, like some real food that people could utilize because they need that kind of stuff. They can't often deal with frozen food, right? So it's got to be shelf stable. But heck, you can buy canned butter. So there are things like that, and it's a quick list, and we've just gotten to zero. So,
Chris, do we have time for one more? Because I want to throw a curveball up here because we got Dave over here.
You shouldn't have asked him that. I knew that was going to happen. Actually, first, a gentle correction to Ben. We do actually get fat-soluble antioxidants, such as alpha-tocopherol, within lipoproteins that come into the cell. Just wanted to throw that out. Oh, I'm sorry. I didn't catch that was the mitochondria. Oh, fair enough.
were you asleep?
I might have been. This is Keto Salt Lake. That's only for the insiders. So actually, this is for Peter. Once again, you sent me down a rabbit hole. Peter does that to me sometimes. And I had heard something a long time ago from my grandfather that I didn't connect until recently. He said, and this was when I was maybe 8 years old, he was talking about the health of the soil, which to me as a kid, I'm like, well, it's just dirt. I don't really get the point of it. And he said, we learned a lot more about it during the Dust Bowl. And he was into football at the time, so I thought bowl, Super Bowl, and all these bowls, right? And then I would later come, literally last year, I would later look up that actually, indeed, that's where a lot of agronomy came from, because unfortunately, we love to learn about things after we've lost them.
Yes.
Apparently, that's where a lot of this science came from. Is that correct?
To a large part. I mean, it starts, you have to look into analytical chemistry to see when we develop the ability to find nutrients. Analyzing a substance for total nitrogen goes back into the 1880s because that's how long we've been estimating crude protein. So it goes back a ways. A lot of what happened in colonial Eastern North America was just tremendously degradative until we developed the knowledge of replacing fertilizers. So we had a lot of erosion and depleted soils. Dust Bowl was a government program because they wanted to replace Russia, ironically, as a wheat exporter because World War I had interrupted the supply, and so they wanted to get more wheat production in the U.S., so they put in a program that would allow people to, till shortgrass prairie that should never have been broken. But they did it in a wet period of time, and because it was native sod, it was fertile. And so they got some really good crops for a couple years, and then it turned dry again. And so then the soil blew. There's anecdotal tales of Native Americans looking and saying grass is wrong side up, right? Dirt is what your mama washed out of your genes. Soil is what life depends on. And yeah, there's been a lot of efforts over the years to stop erosion, minimize erosion, reverse some of that degradation. Certainly since the 30s, it was in the 30s that the Soil Conservation Service got started.
Thanks.
I know we're past time into lunch, but this is such a precious opportunity. If you guys don't mind answering some more questions. I mean, we're keto, right? So we can intermittent fast if need be.
I want to go for the record that you are going off schedule and not me.
I know.
I
this
would
is
get in trouble
like
for doing this.
I'm gonna probably have a rash from my OCD. It's our CDO, as I like to call it. But let's have another question.
This is for Dr. Harper. I'm wondering, because you had mentioned breast cancer, if you had noticed anything in terms of lymphedema improvement, which can happen sometimes after the removal of lymph nodes from breast cancer treatment. I don't know if that's anything you would have come across or anything you're interested in. I'm just a little bit curious about it, if there's been any improvement. And for those who don't know, lymphedema can occur after lymphatic vessel damage, like the removal of lymph nodes, and it causes swelling in a limb and can be very debilitating.
Yeah, so thanks for the question. The question is, I understand it, because Peter was making a lot of noise up here, so.
That's what I do.
He was looking for dirt, I think, somewhere. But yeah, under my nails. Yeah, you won't find it there. I don't work in the lab anymore. Thank you for the question, though. So the question, as I understand it, was, did we notice any lymphedema resulting from the diet or changing because of the diet? And the short answer is no. We didn't look at that specifically.
I was more thinking in terms of lymphedema that had occurred maybe from prior treatment, potentially improving.
Yeah. It's very typical because often most of these women have had mastectomies, often radical mastectomies, and they usually remove the lymph nodes, and so lymphedema can be a problem. The body doesn't drain the fluids. The university I graduated from, University of British Columbia, I can't remember the researcher though, he's the first one to actually get breast cancer survivors rowing. And everybody thought, that's crazy. They're going to have lymphedema. They're going to be all swollen up. Turned out to improve the situation. So we didn't measure it. So when you do these studies, you have to tell the research ethics board exactly what you're going to measure before you start. So you can't you can observe things, but you can't kind of make things up as you go. It's a really good question, though, and it is a serious side effect especially of the radical mastectomy. But we've come a long way from my mother's day when she had her radical mastectomy. By the way, my mother was one of the first radiation therapy patients. She's a nurse, so she gave herself up to science.
So I think we have one more over
Well,
here.
wait, I've got one. Yeah, ladies first over here.
Thank you. How does your view of, and this is for any of the people in the room who can answer this who have been talking, how does your view of the use of statins change when it comes to familial hypercholesterolemia or even non-familial but just crazy high? Is there a limit at which they should be considered? I know I watch tons of videos and we're kind of the other direction, but is there a point at which they do need to be considered?
So with the caveat, obviously, that I'm not a medical doctor, and I will defer to those who, although you're a PhD, right? Is there, yeah, we have no medical doctors on the stage. Maybe we can defer to Dr. Westman or Dr. Berry, but I've read some of the literature on familial hypercholesterolemia, and it looks like the very, very elevated LDL is only one of many factors that contribute to cardiovascular disease in these people. They have a lot of polymorphisms in clotting factor production and fibrinogen, like in all these other things that help clot or help resolve clots. And it looks like when you target, many of you, who knows the name David Diamond or Asim Malhotra, Ufi Ravenscoff, all these people, they're called, the cholesterol skeptics, or some people call them quacks. I enjoy their work. They really make a good case that the LDL by itself is actually not the thing that's driving the cardiovascular disease. Now, whether or not there may be a role for statins, if your cholesterol is, 700, 800, I'll defer to the medical doctors that maybe there's a rationale for lowering that while also targeting those other factors. And there's one paper, I forget the name of it, they show an incredible graph that regardless of the LDL, no matter how high it was, the biggest factor, I think, was triglycerides. Like triglycerides to HDL just dwarfed, to HDL dwarfed the LDL. So but there may be a rationale for statins, and maybe like Dr. Westman has done some work showing that the statins have other effects besides just lowering cholesterol. They do. I mean, I'm not a fan of statins, but there may be other mechanisms that make them beneficial in those situations that are actually unrelated to the LDL. But I'm not a doctor. I'm just sharing what I've read.
So I'm not a physician either, which is good because I can't have my license pulled for saying what I think. There is a small effect for LDL. Dave is probably the guy to talk to. The small effect of LDL, the Jupiter study they talk about and so on, and mortality. But it's really small. Like the number needed to treat is enormous, and it may be because one of the things that statins do, and yes, if you have familial hypercholesterolemia, you should probably be on a statin. But one of the things statins do is they actually inhibit blood clotting. And most of the cardiovascular accidents are due to clotting issues. So, the one thing I would say is cardiovascular disease is not about saturated fat in your diet. Full stop, end of story, no more discussion. So that's one thing for sure. It's not about fat in your diet. Cardiovascular disease is at its root cause an inflammatory disease. And the inflammation is caused by excess sugar in your diet and the AGEs, advanced glycated entities, that cause that inflammation, and endothelial injury that causes, and then the LDL becomes an issue. But the root cause of cardiovascular disease is not diet, it's inflammation. So if you can control that systemic inflammation, you can greatly reduce your risk of cardiovascular disease, so heart attacks and strokes.
Okay, we're going to end on this one right here.
Oh, I hope this is a good question. For Amy Berger, you had talked about having a high incidence of insulin resistance in the various brain disorders, cognitive disorders like Parkinson's and Alzheimer's and those kind of things, but that incidence occurred before any sort of diagnosable diabetes or other sort of glucose indicative diagnoses. And so I'm wondering what is maybe a sign that you should test for some of those kind of things earlier than the diagnosis for diabetes or whatnot. I have a lot of family members who have the Alzheimer's and the Parkinson's and things like that, and they do decline so quickly that if we can find these things in our families before it gets to the point where they might have diabetes or they might have, these glucose indicative issues where the insulin resistance is masked for some time, how do we know when to test and when to look for those things before it gets to the point of Parkinson's and Alzheimer's and those things?
That is an excellent question. And I'm going to, I hate to, I wrote a book with Dr. Westman. We have copies here for sale, but he's a brilliant man. Why shouldn't I quote him, right? He says, what modern medicine does now is pull people out of the river. What we want to do is stop them from jumping in the first place. So how do we stop people from jumping into the river? And I think you can actually have your fasting insulin measured. It's not an expensive test. If you do it yourself, it's $34 or ownyourlabs.com. Dave, you probably do it, I'm sure. It's that's available. In my opinion, it should be a routine part of a standard checkup, just like a glucose is. A1C is not even a routine standard thing, which is crazy to me. So you can measure fasting insulin. However, like I mentioned, in a lot of people, the fasting level will be normal, but when you have your bagel and your orange juice, forget it. So there are sort of telltale signs that will tip you off that there's maybe a problem. The triglyceride to HDL ratio can sometimes be elevated long before you notice anything else. If you have hypertension, not every case of hypertension is metabolic syndrome or insulin, but many are. Essential hypertension, or means we have no idea what causes it. And what was I going to say? It's very individual because some people will have skin tags that indicate chronically high insulin, even if you're not overweight. So it's not just a matter of obesity. Women, if you have any signs and symptoms of PCOS, your facial hair, irregular periods, acne, so there's a lot of things. And I do want to be clear. I didn't have time to address it, but things like Alzheimer's, Parkinson's, the glucose insulin thing is a huge factor, but a vitamin B12 deficiency all by itself can cause neurological and cognitive problems, some of which will become irreversible. Use of statin drugs, you can go to the FDA's website. In my Alzheimer's talk, I normally have a slide that's directly from the FDA's website saying that use of statin drugs may cause cognitive impairment. Not all the statins cross the blood-brain barrier, but the ones that do, how important is cholesterol to the brain? Like kind of a big deal, right? So there's other things that can contribute so it might not always be an insulin issue, but there's all these like little hints that you can look at to see like years before the problem would happen.